Well, hello. It's Bruce Williams again, and it's time for Growth Path Challenge 31. And these slides come to us from the first exam of the 2015 Descriptive Veterinary Pathology course, which was given in Saskatoon, Canada, at the University of Saskatchewan. As I do at the beginning of all of my lectures, I want to thank those friends and colleagues who have provided me images over the years, either directly or through online collections, which allow me to put these little challenges together. First question is tissue from a dog. I'd like a morphologic diagnosis and a possible cause. Let's start out fairly easy. Take out a piece of pen or piece of paper and a pencil. Give yourself 60 to 90 seconds per question and enjoy. Okay, time's up. The condition is right ventricular hypertrophy. If you want to say right ventricular dilation, we'll give that one to you too. The reason we know it's right ventricle is normally there's a little waist here, a little indentation where the right ventricle ends, and it doesn't end here. It's a smooth contour, which suggests that there is either hypertrophy, and this is a very yellowish wall to the heart. Now, it's very difficult to tell hypertrophy, we're adding a bunch of new cells, which is also going to make it whitish, versus dilation, where we're adding fibrosis, which also gives it a whitish color. Okay, there's a lot of blood vessels here, which suggests hypertrophy, but I'm giving full credit for both. Now, a possible cause. This is a slow pitch, and we know that this right heart is pushing against pressure. Initially, those myofibers of the right heart are going to get bigger, like when you go to the gym and you work out. Eventually, they're going to fail. Now, what causes increased pressure on the right heart? Imagine if you had a narrowing of the pulmonary artery, which is taking blood to the lungs, and you're pushing against a very narrow opening. That's known as pulmonary stenosis. It's a pretty common cause of this, especially in young animals. You may also have pulmonary hypertension, where the arterial tree of the lung is constricted due to decreased oxygen tension. And that's also known as cor pulmonale, and that may be a cause. Or perhaps you have outflow disease and you pumped all of the blood into the lung that you can. You have veno-occlusive disease, it's not letting it out, but you keep pumping against pressure. So those are three really good causes: pulmonic stenosis, or pulmonary arterial disease, or venous occlusive disease. Okay, are you ready to move on? Slide number 2 is a classic. Before we get into it, I want you to take a look at the background. I've never been a big fan of red backgrounds, okay, or green either, but I think red is particularly problematic when you're dealing either with specimens that have hemorrhage on it. A fixed specimen like this might not be too bad, and I think this one was taken many years ago at the Walter Reed Army Institute of Research back in the mid-60s when they were using red backgrounds. So let's take a look. This is tissue from a rhesus macaque. I want you to give me a morphologic diagnosis and a cause. Okay, time's up. You should get this one even though it's a fixed specimen. Color's not very good, but here's a cross-section through one of the pulmonary lobes, and you can see that all of the airways, including the terminal bronchioles and maybe some of these secondary bronchioles, are markedly dilated. They're surrounded by this whitish tissue, probably fibrous connective tissue. If I could show you a fresh specimen, you could see that there would be a golden brown pigment around this. And this is the classic appearance of mite houses, which are made by the lung mite Pneumonissus simicola. They have a direct life cycle. They all live in the same mite houses, adults and nymphs. And over time, their wiggling and jiggling and tickling inside this wears away all of the elastin, and then the bronchioles become bigger in diameter. They also are often surrounded by granulomatous inflammation because the mites poop in there, the macrophages clean it up, and the mite poop or mite pigment is sort of a golden brown color. So if you will see this in the live specimen, you'll have these areas of pink inflated lung and then sort of these golden brown dilated lumps within, and those are the mite houses. Okay, so this is pneumonitis simicola. The morphologic diagnosis is multifocal to coalescing granulomatous bronchiolitis with bronchiectasis. Okay, ready for another? Well, here we go. This one has a little bit to do with monkeys, but I am going to tell you that this is from a snake. Type of snake, probably not that important. I want you to name the agent. Okay, so we're looking at this snake, and for those of you who don't look at a lot of snakes, the organs can be very confusing. This is a tubular organ. It's been opened up. It's been laid out. You see this very characteristic retiform pattern. That's what snake lungs look like. They don't do very good in terms of airflow. The air comes through one area, sort of down through the airways and into these dilated areas for exchange. But moving on from that, we have these large arthropods. They are degenerate arthropods. They don't have any limbs, and these are known as penistomes. When I said this might be something to do with monkeys, we very often see in wild-caught macaques the embedded fragments of these degenerate penistomes. They're often in the pleural cavity or embedded in the omentum. Usually they're old, they're broken down, they're devitalized, generating a little bit of granulomatous response. And those are the macaques are the intermediate host for most of these. Millefera armulatus is one species that is not uncommon. And then, because the definitive hosts are generally pythons or constricting animals, there are a number of them in the Porcephalus genus as well. Porcephalus probably uses a variety of rodents as intermediate hosts, and sometimes these are referred to as tongueworms. But characteristically, the adult penistome is found in the lung of snakes, and the intermediate host, they're much smaller. They're sort of curled up, armored-looking round agents which are embedded in the serosal membranes of organs in the pleural cavity or the abdominal cavity. Okay, this is slide number 4. We are looking at tissue from a rat. I need you to give me 2 morphologic diagnoses. Okay, you're going to say, but this slide's a little blurry. That's okay. As an older pathologist, everything gets a little blurry when you get old. But older pathologists are the best pathologists because we've had lots of time to accumulate facts. So don't worry about everything being in focus. Color's not too bad. It's from a rat. You might have seen this in a book called Percy and Barthold, because I think this slide came to me from Dean Percy himself. Good fella. What a great guy. University of Guelph. Plays the bagpipes. Okay, so back to the slide. 2 very common neoplasms in a variety of strains of rats, especially Fisher 344s, to a lesser extent in Sprague Dawleys, occur in and around the testis. The first one, when you look at the testis, which is right here, it's been partially incised, and you see all this white tissue. It's not normal testis. These are interstitial cell tumors. The most common neoplasm of the rat, most common neoplasm of the dog. While they do have a potential to be malignant, it almost never happens. Very, very rarely. I consider them benign tumors. Great It's a great appearance of one. You can usually see them through the vaginal tunics. You don't have to incise them at all, and you see these big sort of plaques of white, bright white tissue. That's an interstitial cell tumor in a rat. Now the other one is this tumor, this pearlescent tumor that is arising from the vaginal tunics. Remember that the vaginal tunics in rats go through the open inguinal canal. They connect with the peritoneum, and this is a mesothelioma. This animal may have mesothelioma going up into the abdomen, and that's where it came down from, or it might have originated here, and you won't find it anywhere else. One of the reasons that people stopped using Fisher 344, which are really nice rats, they're not used very much anymore, is because they have these two tumors and one more tumor, mononuclear cell leukemia. You might have heard that as large granular cell leukemia. They have them often all at the same time. Just too many tumors in this trait of rat for long-term studies. So great rats, but they get these tumors. Interstitial cell, mesothelioma, and we need a microscope to look in the vessels of the testis to find out if we could find that mononuclear cell leukemia lurking at the same time. Okay, slide number 5. Tissue from a pig. I would like a morphologic diagnosis and 5 possible causes. Take your time. Okay, time's up. Morphologic diagnosis. We're looking at a pig. We have multiple vesicles, one that's ruptured. This one looks like it's about to rupture. Maybe there's one growing here. Some fluid leaking out. This is multifocal, vesicular, nasal dermatitis. So now all you have to do is remember the vesicular diseases of swine, and they get all of them. Now, bottom line with vesicular disease, most of them haven't been seen in many years. Most of them don't cause much of a problem. But we keep track of them because there is one caused by an aphthovirus, which causes foot and mouth disease, which causes massive outbreaks. And while foot and mouth disease doesn't really kill a lot of animals, it is so contagious. And remember, when you're talking about production animals, it's production, it's feed conversion, it's growth, it's milk, it's whatever. And you get vesicles on the teeth, you get vesicles around the mouth. These animals can't eat, they can't do what they want, and it causes massive economic problems. And it is so incredibly contagious that's why we track all the other ones as well. Okay, swine are the amplifier species. Foot and mouth disease can be transmitted very easily by trucks or trucking animals around, even by wind, as was shown. It could be airborne. In a major outbreak back in the late 90s, early 2000s in the United Kingdom. So it's a bad actor, and that's why we are so careful about vesicular diseases. They are so reportable. Okay, I call that swine aphthovirus. It's the same aphthovirus that affects all species, but I'm very dogmatic as to, at least for a testing situation, what you call it. Every time you ask for an agent, you should, and it's a virus, you should give the species or the type of animal that gets it. So it'll be swine and the genus of the virus, swine aphthovirus. Okay, another one that will cause blisters is swine rhabdovirus. The cause of agent is vesicular stomatitis. Doesn't cause that much of a disease in pigs. Can cause outbreaks in horses. We see them occasionally in the southwestern United States. In the southeast, rarely, about every 10 or 20 years. In the southeastern United States, vesicular stomatitis. Swine calicivirus is a disease I haven't seen an outbreak in many years, at least in swine, but it does still circulate around the sea lions in the southwestern United States, the coastline. It's known as the San Miguel sea lion virus from where it was first identified there. And you can still see it occasionally in sea lions. It's not uncommon. Intermediate host is the opal-eye fish. It gets into the opal-eye fish. And opal-eye fish often get caught in the tidal pools. When the tide goes out, they're swimming around, and sea lions like them, and that sort of keeps the virus endemic. But that goes back to the feeding of, or the dumping of garbage, which might contain infected scraps of pork meat. And that's how it got into the ocean and into the sea lions. So that's swine calicivirus. Swine vesicular xanthoma is a picornavirus. We don't see it much anymore, but one that we do see is another picornavirus that has popped up within the last 20 years, first isolated in 2002. First seen as a cell culture contaminant. There have been a number of cases of outbreaks of what were initially called idiopathic vesicular disease. Now it's called Seneca Valley virus. Seneca Valley virus, another picornavirus. So that's 5. Swine aptovirus, 2 swine picornaviruses, swine calicivirus, and finally swine rhabdoviruses. So know your vesicular diseases, which species get which, and that pigs get every single one that comes down the pike. Okay, slide number 6 is an absolutely great slide from Dr. J. Kohler. This is tissue from a cat. Can you give me a morphologic diagnosis? Okay, time's up. We have a heart that is open. There's moderate left ventricular hypertrophy. It's very difficult to tell, so that is not the morphologic diagnosis. What I want you to see is this network of moderator bands. You call this moderator band cardiomyopathy. That's as good a name as any. This is a particular disease that is occasionally seen in cats. The moderator bands are primarily seen within the left ventricle. It has been recently classified as a type of cardiomyopathy. These animals show a wide range of clinical signs, including cardiomegaly, but the heart rates are not significantly different than those of normal cats. It's also been associated with pulmonary edema, pleural effusion, murmurs, and aortic thromboembolism. So those of you who classically thought about dilatative, hypertrophic, and restricted cardiomyopathy, now you have a new one to add: excessive moderator band cardiomyopathy. Slide number 7 is a slow pitch, hopefully. After that last one, which was a little tricky, this is tissue from a foal. Can you give me a morphologic diagnosis and a cause? Okay, time's up. I heard through the internet, everybody's pencils, writing, scrabbling, pen, papers rustling. I know you were working your way through this one. This is from a foal. All of these that we're looking at are mesenteric or colonic lymph node. They are massively enlarged, granulomatous inflammation. This is a diffuse granulomatous or pyogranulomatous mesenteric and colonic lymphadenitis. Now, if we opened up the colon, we would probably see areas of granulomatous inflammation involving the Peyer's patches, maybe sort of carved out, look a little bit like volcano ulcers, but we don't. So let's just stick with the colonic and mesenteric granulomatous inflammation. In a foal, till proven otherwise, this is Rhodococcus equi. If I was looking at an adult animal, maybe I'd think about strangles for just a little bit, but in a foal, it's Rhodococcus equi, primarily a respiratory infection, but the animals, when they develop pneumonia, they'll cough it up and they'll swallow it, and it will get into the GI tract and the draining lymph nodes. This is a very successful exploiter of macrophages, and where the macrophages will eat it up, they cannot fuse a phagosome and a lysosome, so they cannot get rid of this particular agent. The agents of Rhodococcus, Actinomyces, Nocardia are sort of closely related in their cell wall construction to Mycobacterium with mycolic acids, and very difficult to for the body to get rid of. Okay. Slide number 8 is tissue from a dog. I'm going to ask you for a pathogenesis on this one. Remember that the pathogenesis is 4 or so big basic concepts separated by arrows, and one is usually the cause. The first one, the last one, is usually the lesion, and then there's a couple of important things to put in between. So let me give you about 90 seconds to work on that, and we'll come right back. Okay, time's up. It's from a dog. Okay, we have sort of a scurfy looking paw pad here. That's a big clue. We have all these nodules in the liver. That's a big clue. How do you get from a scurfy paw pad to a nodular liver, or vice versa? In this case, it's vice versa. When we see these large nodules within the liver of a dog, we're automatically going to think about cirrhosis. And how do you get cirrhosis? The first thing is you give the dog a low-level hepatic intoxicant, which is not going to kill him outright, like mushrooms or blue-green algae or something like that. But maybe you're giving him something like an anticonvulsant. And this anticonvulsant kills off a couple of hepatocytes every day. But the cool thing about the liver is it has the ability to regenerate those hepatocytes. Unfortunately, it does a pretty poor job of it, because at the same time it is regenerating hepatocytes, it is also telephone interruption. Okay, so when you injure hepatocytes, they respond really well and they regenerate, but also at the same time, they also generate fibrous connective tissue. So it's a race between regenerating hepatocytes and fibrous connective tissue, and oftentimes the fibrous connective tissue will encircle, if not infiltrate, the regenerating hepatocytes, and that causes a lot of problems. But grossly, you get these nodules of regenerating hepatocytes. That's why my morphologic diagnosis is macronodular hepatocellular regeneration and fibrosis. This is a dog and cat thing, a little bit maybe a parrot thing, but a lot of other species like horses and cattle and etc., they don't do the hepatocellular regeneration as well, and their cirrhosis is sort of characterized by fibrosis and progressive miniaturization and contraction of the liver. But in a dog, it's always macronodular. Oh, people do it macronodular too. Okay, so my first concept is going to be chronic low-level hepatic intoxication. Next one is going to be macronodular regeneration and fibrosis of the liver. Okay, now we got to get to that scurfy paw pad. Well, that scurvy paw pad is a condition known as superficial necrolytic dermatitis, and it's always associated with liver disease, sometimes pancreatic disease, maybe a tumor like a glucocarcinoma, but it's often due to liver. And the problem is that this failing liver does not utilize amino acids very well. So we have derangement of amino acid metabolism, then catabolic changes to the paw pads, and finally, superficial necrolytic dermatitis. Let me run through that again. Pathogenesis: chronic low-level hepatic intoxication, macronodular hepatic regeneration with fibrosis, in parentheses cirrhosis, deranged amino acid metabolism, catabolic changes to the paw pads, superficial necrolytic dermatitis. That is the one that if you look at under the microscope, you're going to get 3 very classic stripes, red, white, and blue, which is the colors of the French flag. Not wanting to be a homer here or American-centric. So it's the colors of the French flag, red, white, and blue, and the top part is a thick layer of hyperkeratosis, which you see grossly. That's the red part. The white part is superficial edema of the stratum spinosum, and spongiosum, and finally a thick layer of proliferating basal epithelium, which will be blue, red, white, and blue. Okay, we have spent a long time on that one, but it's a great picture, great lesions, and let's go on to slide number 9. Slide number 9 is tissue from an ox. I want a morphologic diagnosis, an etiologic diagnosis, and a cause. Okay, time's up. This is a great one. A couple of great lesions. We have a big thrombus here in the right ventricle. So we're pushing it out. Don't get excited about that. Some thrombi up here too in the great vessels. Let's not worry about that. What I see is multifocal areas of hemorrhage and necrosis within the left ventricle, a little bit in the right ventricular wall. And the left ventricle, it looks sort of dry. It looks dry to me. It doesn't look like it has a normal, pronounced vasculature that the heart does. So dry and areas of hemorrhage necrosis. To me, multifocal coalescing myocardial necrosis and hemorrhage is caused by Clostridium shovii. This is blackleg. Etiologic diagnosis is a shortcut version of the organ and the agent. So if you said the etiologic diagnosis is clostridial myocarditis, perfect. Or if you said it's myocardial clostridiosis, great too. Either one is accepted. Put either one in front, doesn't make any difference. Great case of blackleg. How's it happen here? Usually you have to have areas of ischemia. The cow's body is not a sterile place. It has pre-positioned spore-forming Clostridia of multiple types throughout the body, in the liver, in the muscle, both skeletal and cardiac, just so one day it can get itself into real trouble. And if it's in the muscle and you give it a vaccine or you hit it in the butt with a shovel or a front loader to get it to move into the milk parlor, and you cause a big bruise in an area of ischemia, you may cause blackleg in the large muscles of the hind legs, because Clostridium shovii needs areas of hypoxia to germinate and to proliferate. The heart is a little different. You're not going to hit a heart with a shovel. There's not a lot of trauma there, so perhaps it is because the animal is stressed, and you just get this tremendous catecholamine release and pumping of the heart, and maybe you get a little bit of ischemia. It happens. I don't know if it's well explained, but certainly the heart is a great place to see lesions of blackleg. Okay, one more slide. This is tissue from a dog. And I want two morphologic diagnoses. Okay, if you work with military working dogs like we do here at the Joint Pathology Center, you just work with a lot of old dogs, you're going to see this all the time if you look for it. And it's an important concept to understand. Intervertebral disc rupture, we know a lot about that in dogs, especially long dogs. Oops. Oh, my picture's disappearing. There we go. Especially long, low dogs like dachshunds, and they have these type 1 disc ruptures, and they rupture out their lumbar discs, and sometimes they can do it with such force that they'll cause infarction of the immediate infarction of the overlying spinal cord. Usually they push a little bit into the spinal canal, and progressively they get degeneration of the ventral funiculi due to the pressure on the spinal cord. So we got that, but we see this a lot. We see a lot of disc ruptures. Okay, in the long, low breeds, it goes dorsally. In most breeds, German Shepherds, we see a lot, but it could be an old lab or it could be something like that. They also rupture. This is where the nucleus pulposus is, you can see, but in most breeds, they rupture downward. They rupture downward. They're not going to cause any problem with the spinal cord. But what happens when you push the material downward is you get a reaction of the bone and the periosteum. You get bridging spondylosis here. And you see this a lot in older dogs if you take radiographs, and that's because they're blowing out their discs, but they're blowing them out ventrally. So your two morphologic diagnoses, one is intervertebral disc rupture with extrusion of the nucleus pulposus. Second one is ventral vertebral spondylosis. Okay, so not all of them, as a matter of fact, few of them go north, most go south, causes very common arthritic lesion in older, large breed dogs. Okay, that's 10. It's been 30 minutes. Thank you for hanging in. I'm going to miss a couple weeks here. I got some surgery coming up on Thursday. I blew out my Achilles tendon. So I'm going to be laid up, and I think I'm going to have to skip a couple weeks. I hope you've enjoyed this. We've now got 31 of these, so feel free to go back and take some of the challenges you haven't, or we have a lot of other lectures available to you, so you can sort of bone up. I'll probably be back in a couple weeks to continue into the 30s and the 40s with these. I enjoy doing it, and I hope you're enjoying taking them too. Till I talk to you next time, have a great week and a phenomenal weekend.